We come to serve children that are impoverished. So we go in and we build on what is there. We have a highly focused goal there. We are trying to give them modern medical information in a way that they can retrieve it instantaneously, that they can use it at the bedside to take care of patients, that they can use it to take home for self-knowledge and to use for teaching. Because we know when we go into these public facilities that they have so little capacity to do that. We really have a desire to have high impact in the time we have. When we were in India, we did 15 trainings. We trained 750 doctors. And when you really think about the scope of this, it's staggering. Every one of those doctors sees on the average of 5,000 to 10,000 kids in a year. We're providing them with a piece of software that they can access within seconds to help them with decision making. If you do the arithmetic, it's almost unfathomable what we are accomplishing there in terms of potential benefit to care of children. We are giving them access to the most current scientific knowledge in the world, and we follow up with them. We look at how they use the software. They send us back evaluations of how they're using it in the clinical settings, and they use it all the time. And many of the doctors are using it as their primary methodology for teaching other doctors how to practice medicine. The hospitals and the medical schools cooperated wonderfully with us. They got the students there, they got the doctors there, they got the attendings, the professors there, and we dealt at the very beginning with the leadership. We got their buy-in, and this, I think, was really key for us. That this was an incredibly important thing that we were doing, that it was going to make a big difference in the care of patients there and in their personal learning.
People have already started using it from day one. So that, I think, is the best feedback, and that's because it's comprehensive and yet concise. It gives you everything, and you can use it on the bedside, which I think is where you need it the most.
I had spent a lot of my early career developing hard copy textbooks to support work in my own specialty in pediatric emergency medicine. And after doing 5 different textbooks, with the help of many hundreds of doctors that were my colleagues, I realized that this was definitely a dead end. And so I came up with a notion of doing this in a platform that was changeable, electronic, and I had a partner that I found when I was doing some lecturing in Australia, and he and I founded a software company called PemSoft, and it became very successful very quickly. And as soon as we published the first version of the software in 2006, I started giving it away to colleagues in Vietnam and saw that they could use it just as well as we could. Because here's the really cool thing, that every doctor in the world has a cell phone. And every doctor in the world knows how to read American medical English. And then we were acquired by a big company, EBSCO, that was producing the biggest piece of online software in the world. They had really liked what I was doing with the nonprofit KidsCareEverywhere. And the president of the company, Tim Collins, said he wanted to continue to donate to software in the low-income world as much as what we could possibly do within the context of our organization, as long as it did not compete with their commercial interests in the Western world. So that is what we have done since then. And we have given the software away in 26 different low-income countries, and we continue to give it away on a constant basis in new places every year. It is so phenomenal that it is almost unbelievable. The program is a compendium of all of the world's medicine and a review of all the scientific recommendations that have come down internationally up to 4 weeks ago. And it actually addresses all of the specialties of medicine, even though we have chosen to use primarily the medical pediatric part of it for the work that we do, since we have such a really strong emphasis on children's health. But it would be probably about 75,000 pages if you would print it out from the software itself. So it has so many different features and so many ways that you can get to the information you want. The software is updated 3 times a day on their staff at EBSCO, who owns the software, about 75 people who review the literature constantly. And they are not only reviewing it, but they are evaluating it for validity. And this is one feature of this program that I love so much, which is that not only does the software tell you the latest recommendations for any diagnosis and treatment, which is largely what we are going for, but it also gives you a level of validity of the recommendation. The software actually gives you a way of interpreting how likely it is that the diagnostic and therapeutic recommendations are valid. And that is a phenomenal change from anything that we ever had access to in any of our medical careers. 95% of what we receive goes directly to programs, and this is really extraordinary. Despite that we have a huge amount of free professional assistance, despite the fact that we get $1 million of one of the world's finest and most current softwares for free, we still have a huge expense of actually getting to these sites and conducting these missions. We have a desire to do way more. We have seen the transformational effect of what we do, and we see the enthusiasm of the doctors about what we do. But we are limited, of course, by money, by the lack of adequate staff to staff more sites. But there's always more things to do that we can't do. And this is the frustrating part of what we see, that we can provide an incredible opportunity for these doctors to access knowledge, but we can't do enough of it. For us, we are totally dependent on our donor community, who's been incredibly loyal to us, but we need more, we need better resources, we need more staff, and when we have that, we can just continue to expand the project that we're doing. And I think if we ever sat down for 1 minute and calculated the number of lives we have saved, the number of doctors whose careers we have improved, the number of disabilities that we have prevented by earlier intervention, it would be staggering.